Okay, female repro. If you recall, in the dog, we had short uterine body, 2 uterine horns, ovary at the end of each of these, little uterine tube that came up and back down the side there. Then down here we had a cervix. Then went into the vagina, and then when the urethra opened up into that, we had the vestibule behind that. So vestibule, vagina, cervix, uterine body, 2 uterine horns, and ovary up there. We will have this same set of organs in the large animal. They will be a little bit different shape between the species, and we'll go over that. And the other thing to recall, in the dog, we had an ovarian artery up here that came off of the aorta. We had a vaginal artery back here that came off our internal pudendal artery. And there was a little uterine branch that came off each of these and ran down the side of that tract like so as our uterine artery. We're going to talk about it in the horse and the cow. There's another specifically named uterine artery that's got an origin over here that will tie into the middle of this. So we'll come back to that. Now in the mare, you've got these diagrams in your hands by now. Again, vagina here, cervix there, nothing new there. Uterine body here. The uterine horns will diverge sharply from one another like so. We've got our ovary down here at the end and a little uterine tube. Uterine tube is easier to see in the horse than it is in the dog, just because of the size of it. And one thing that I've noticed in the 2 female horses we have in the class this semester is they've got very small juvenile tracts, so I won't be labeling anything on the tracts in our wet specimens. If I do anything, it'll be on the dry specimen type stuff, the plasminated organs that you see in the display cases. And if you were to look at this, you can see on our broad ligament here, here's mesometrium going to the part of the horn there. So mesometrium going way over this part of the horn, and mesometrium going to this part of the horn. You see how it's longer in the middle? If you were to look at this organ from the side, when the horn comes up, it sags down and comes back up like this. So dorsal up here, ventral down here, little ovary right there. Our little suspending peritoneum, there's our mesovarium up there. Here comes the mesometrium. It's longer in the middle than it is at the front of the back, and so this horn will actually sag down like that in the horse, where in the dog it was a little more evenly distributed like so. It would have a dip in there, but it didn't do this. That's in the standing dog, not when you've got it on its back doing a spay procedure. So it will really sag in the middle in the equine. The one thing about the equine ovary will be different, and we've got another structure that is different in relation to that. If you recall, the dog, our ovary was here, and when the mesovarium came out and wrapped around it, it didn't come straight back, but it flipped over like this, and that was our mesosalpinx, and we had our ovarian bursa in here, and this opening over here was just a little bitty slit. Well, this will be different in the equine. In the equine, the ovary is sitting here. Mesovarium comes around right there, and when it flips back on itself, it doesn't come all the way over. It just comes partially over like this. So the ovarian bursa is shallow. So when these ova exit like they do in the dog here all over the surface, if that was happening in the horse, we would be losing the ova that were coming out over here. Okay, and that's not good for reproduction. So what we will see in the horse ovary is, if you take a look at it, there is a pit in the ovary. There's a pit in it. That is the ovulation fossa. It's got an ovulation fossa in it. So all of those follicles, instead of migrating to the surface all around like they do in the dog, they migrate to this one point. And they all come out this one point. And that one point will be down over here underneath that bursa, so that those ova will not escape out like this into the peritoneal cavity. They will come in here, down the uterine tube, into the uterus like they need to be. So we've got an ovulation fossa in the horse ovary. That is a normal structure. Some other information on the horse ovary. So, equine ovary. These are located cranioventral to the wing of the ilium. They're located cranioventral to the wing of the ilium, about the level of your L5 vertebra. Horse only had 6 lumbar vertebra, so this is just barely in front of the sacrum. So they're way, way back. So when you do ovarectomies in large animal, horse and cow, you often will do those in a standing position, and you will enter through that paralumbar fossa. The cow has that too. We've not gotten down to talk about it yet, but you will go through that paralumbar fossa. That's about where L5 would be, and your ovary is going to be located right in there. So that's where you would find those in the horse. In the cow, once again, we've got vagina, cervix, we've got 2 uterine horns, and what we will see in the cow is these uterine horns will curl. They're going to curl and come back towards itself. I'll show you a lateral view picture of this that looks a little better. And in between these 2 horns, when they diverge, there's a band of tissue right there. There's a little number 7 on it at that point. That is the intercorneal ligament. Means between the horns. Intercorneal ligament. It's right there. And you will use this when palpating cattle. When you put your hand in per rectum, you will be dorsal to the reproductive tract. This tract is going to sag down into the abdominal cavity. It's pelvic cavity back here. This will be abdominal cavity up there. And you will take your index finger and you will go down, palpate the front of this. You will hook that intercorneal ligament and lift this back up into the pelvic cavity so you can palpate on those ovaries and check the state of those ovaries, whether follicles, corpora lutea, stage of pregnancy, and you will use that as a little handhold to get this back up to where you can get to palpating on it. Looking at this from a lateral view, here's that horn coming and curling back around on itself right there. In the small ruminant, we're going to see this curl around and back almost again in the goat, so it'll get a little more curvy there. And you got the uterine tube drawn on this diagram here, infundibulum and ovary over there. So this is just showing you the lateral view of this thing curving back around on itself. Intercorneal ligament right up there. Now this tract is facing the opposite direction. Cranial is now over here. And you can see here is our pubic symphysis there. This will drop down off of the pelvic cavity down into abdominal cavity. So this is where you put your hand in and you grab the intercorneal ligament and pull this back up here so you can start palpating on this. When it falls down there again, just pick it back up and move it up here again. So that's what the intercorneal ligament is used for. So make sure you remember the name of that structure, the intercorneal ligament. So in the ruminant, we're going to say the cow. We won't worry about small ruminant. So cow ovary. The ovary will be located ventral to the shaft, also called the body of the ileum. So the equine ovary was out at L5, out at the area of that wing of the ileum. This ovary is back along the body of the ileum, and the ovary will be joined by the mesovarium, joined to the body wall immediately cranial to the pelvic inlet. So joined to the body wall, immediately cranial to the pelvic inlet. So this one's farther back because that uterus in the cow curled back on itself like so and brought the ovary back here instead of it being farther forward. So that curl brings it back to this position here. The porcine uterus. This is what the uterine horns look like. They're extremely long and tortuous, and they will look like small intestine, but when you take a look at them, they will appear thicker and have a bunch of longitudinal creases in them due to all the musculature of the mesometrium. So once you've seen this and have held it in your hands, you won't be very unlikely you confuse it for jejunum or ileum just because of the thickness of it and just the appearance. But first time you see it, it will look like small bowel. And if you look at the cervix right here, the cervix on cross section, you can see this interdigitating pattern, and the semen in a sow will not be deposited back here in the vagina, but the penis will actually make its way through the cervix and it will be deposited up here in the uterine body. So that corkscrew design of the free end of the pig penis, it's designed so it can get through this. It's not going to drill through in a circular fashion. It would twist itself off if it did that. It just kind of just lifts this and drops back and lifts and drops and lifts and drops. It works its way through here. So those two things designed to work together in that fashion. So there's the reason the end of the pig penis appears the way it does. No more specifics on female reproductive tract of the pig. Long horns because they're having long uterine horns because they're having several little piglets at a time rather than just one foal or twin lambs. And they're going to have 10 to 18 different piglets. So that's why all the extra room and board. Now coming back to this picture here, this was our ovarian artery. This was our vaginal artery. The true uterine artery we have here, and it will come in right there and swing cranial and caudal to connect up to our ovarian and vaginal arteries. This is the true uterine artery right here coming in. and then having these two branches there. In the horse, this uterine artery comes from the external iliac artery. The uterine artery comes from the external iliac artery in the horse. In the cow, we have an internal iliac, gives off the umbilical artery, and that's the one that gives off the uterine artery in the cow. So horse, uterine artery comes directly off external iliac. Cow, we have an internal iliac, gives off the umbilical. That gives rise to the uterine. So the umbilical artery, when it closes down to form the round ligament of the bladder, it closes down from the umbilicus in a caudal direction or proximal to it toward its origin, but it will stop. It will stop closing up to allow this uterine artery to be have blood, so the proximal end of this umbilical artery will be patent and functional. Dr. Whitlock is one of our bovine practitioners, and he is aware of this little nuance right here, so don't forget that point. The udder. We're going to use the cow as an example right here. Glandular tissue up here, you will see this in your histology course, so I will not be focusing on that. I will be focusing on these spaces down in here. 10, right there, we've got the lactiferous sinus. Lactiferous sinus. And I've got a couple different pictures here. One of these will break it down into the two components. This one, at this point, doesn't do it. But this is the gland here. This is the teat out here. So the lactiferous sinus is broken down into two parts, and there's actually an arrow to each one of them. This top part here is called the gland sinus, and this bottom one here is called the teat sinus. So lactiferous sinus has these two subdivisions to it, just determining where this collecting system is sitting. And then we have the papillary duct here at 11. This is where the milk will exit through the teat at that point. Now, one thing I want to point out on this diagram as well, we have number 9 and number 12. 9 is your medial lamina of the suspensory apparatus of the udder, and 12 is the lateral lamina. So this is connective tissue right here. You can see it, they've got it colored in black right there. It's coming off connective tissue out here, that abdominal tunic structure that we saw. It's out over here. What do they have? We have one's external abdominal oblique, and here this is external to that. And they've got this coming down with fibers jumping into the gland. It comes through here and comes down the midline with fibers jumping into the gland. I want to point something out. This lateral lamina is collagen fibers. It'll be collagen fibers. The medial lamina is elastic fibers, primarily elastic. So as this udder fills, this collagen doesn't stretch, but the elastic can stretch. So as this fills, the medial portion of this gland can sag down, the lateral portion doesn't, so it's going to sag like this. And as that gland fills with milk, that teat is going to start deviating laterally. So you can actually tell in the cow how full the gland is, besides just the swelling of the side of this thing, but you can see the teat being redirected laterally because the medial part of this stretches and the lateral part doesn't. So collagen fibers here in the lateral lamina, elastic fibers in that medial lamina. Let's see what we had in this picture here. This is just a close-up here of the papillary duct coming out through the teat, and this one is the one that has lactiferous sinus, and they've got it divided into gland sinus and teat sinus for you right there. So that's just what we talked about in that previous picture. Another picture just showing these laminin here again. It's not showing the cross section through the teats, but it's kind of a little more bolded there. If you prefer that picture over the other, you've got that. And then here is one that just shows them from a lateral view. And so these are 2/4 on the same side of the animal. Okay, I want to bring this up now. When you are looking at a mammary gland, this will be small ruminants, so like the goat that you have. We have our teat sinus in here, gland sinuses here, and then we have all of the lactiferous ducts that are dumping into the lactiferous sinus. All of this duct system will come into this one teat sinus, and it's going to exit this one papillary duct out into the bucket you collected in, or into the little kid goat right here. So this diagram is a representation of what an animal has on one side of the body. Now, not down here. We've got more teats in the dog and the pig, but this top row here, it's representative of what you'd see on one side. So the goat, you would have one right there, and you would also have one over here, kind of on the back side like this. So one teat opening, one gland system in that one mammary gland you see on that side. Let's jump over here to the cow. The cow, we talk about the mammary gland having quarters. There's one quarter here, one quarter there, and we have the same thing on the other side. We have another 2. So we're going to kind of draw this one kind of like I did over there. You'd have another teat here off the other side. You'd have another one there off the other side, like that, and there would be our 4 teats. So one gland system in each quarter right there, one opening down here on the teat. So basically it's built just like the goat, except we've doubled it here in the cow. We've got 4 mammary glands right there instead of 2 in the goat. Now let's take a look at the horse. When you look at the horse from the outside and you just look at the silhouette, it's going to look like the goat. You're going to see one gland on each side. You're going to see one gland over here. But if you look inside, there are 2 gland systems inside that one half you see over there. So on the outside, the horse looks as if it is built like a goat, but on the inside, it's built like the cow. And if you notice I want you to take a look at this on those 2 females we have in the class. There are 2 openings on this teat. We only had one over here in the cow. We only had one over here in the goat. So the horse is sneaking an extra quarter in here, and it doesn't look like you've got it until you start looking at the outside, or you start looking at this picture, or you cut one open and dissect it. So trying to be sneaky right there, but notice those 2 openings on the teat. Make sure you see that. That way, I don't know, 7, 8, 9, 10, 11 years down the road, when you actually stop to look at one, you're not surprised. And then down here in D, you got the pig. It's built like the horse, except we have several of these down there, and then the dog has many openings. So I'm not going to worry about these bottom 2 over here. Won't ask you anything about this. I want you to know these guys up here at the top. One thing I want to point out on the drainage of this udder, you need to know some of these things when you start dealing with mastitis cases and things of that nature. These veins are following the arteries, okay? So up here at 6, we have our internal pudendal artery up there. External pudendal artery is down here at 5. And this is our internal thoracic artery up here inside the abdominal cavity. And right here, where this pops out, the piece you see out here in the dog at the end of our internal thoracic artery, there was a cranial epigastric artery that stayed on the deep surface of the rectus abdominis, and it had a cranial superficial epigastric artery, that came out. In our dog, it was always cut. It came off of the skin. That is what that vein actually is, the cranial superficial epigastric vein. Okay, because this is a picture of the veins. Veins are just following the arteries. If you remember our external pudendal artery, it came out and continued caudally and cranially. It threw off that caudal superficial epigastric artery. So back here, that is actually our caudal superficial epigastric vein. Okay? Cranial superficial epigastric vein, caudal superficial epigastric vein, and they will actually anastomose end to end. And this is this big vein here that you can see down in the ventral abdominal region of a cow, especially a dairy cow. That's what they're calling this subcutaneous abdominal vein or milk vein. Okay, they're going to call it the milk vein. That's where it's coming from. And then back here, there's a little ventral labial. We won't worry about that, but there is more drainage to the back of this udder at that location. But those cranial-caudal superficial epigastric veins, those are what is forming your milk vein. And then the drainage, lymph drainage of that, I just want to point out in this picture right here, what they call the mammary lymph node. The mammary lymph node, that's your superficial inguinal, and you know what that is. You've seen them in the horse and the dog. So the big mammary lymph node there, when you start dealing with mastitis and things of that nature, the mammary lymph node is the superficial inguinal. So main drainage, lymphatic drainage going through that lymph node in the cow. As far as innervation to that mammary gland, on occasion you may have lacerations out here, or you may want to be going in and doing some type of manipulation to this gland. So whether you're sewing something up or cutting into it to do something to it, we have innervation to this mammary gland. So we'll just kind of put it on this page right here. The deep tissue in that mammary gland, the deep structures, that is coming from your genitofemoral nerve. The genitofemoral nerve will be doing the deep structures down inside that gland. Genitofemoral nerve will also bring in sympathetic fibers. I won't ask you that, but that's where we're getting those things in for innervation of the actual glands and milk letdown and things of that nature. Okay, superficial. The skin over this gland. It's going to come from 3 different areas. So the superficial part of this innervation and the cranial portion of this mammary gland, it's coming from L1 and L2 spinal nerves. So innervation is coming from L1 and L2 spinal nerves. The middle portion of the skin of this gland in here is coming from genitofemoral. So genitofemoral is doing a lot of stuff here. And then the caudal skin region of this gland, that will come from the pudendal nerve. Pudendal nerve. So it is receiving nervous innervation from 3 different areas, cranial, middle, and caudal, from, there's really 2 nerves here, but nerves from 3 different sources. So that is our innervation to the skin of the mammary gland. And we will end this lecture right there.